We are observing a subject with a documented history of severe electrophysiological instability. The clinical baseline includes recurrent supraventricular tachycardia and polymorphic ventricular tachycardia, managed by a subcutaneous implantable cardioverter defibrillator. Currently, however, this subject generates a VO2 max of 64, sustains outputs of 13.8 METs, and reaches a peak heart rate of 176 beats per minute during high-intensity intervals. These performance markers have been tracked across a 9-year longitudinal period, with no recorded arrhythmic episodes or device interventions during exercise. This data presents a clinical paradox. Under traditional models, extreme metabolic demand in an electrophysiologically vulnerable heart is expected to increase the probability of an arrhythmic event. In this specific case, the sustained absence of triggers indicates that raw cardiovascular output, the speed of the heart rate itself, may not be the primary driver of instability. Standard clinical assumptions suggest that high-intensity multidirectional loading is contraindicated for patients with this level of cardiac vulnerability. The primary concern is the sympathetic panic loop, where the nervous system overrides cardiac coherence during intense physical exertion, potentially leading to electrical failure. Biomechanical analysis of the subject suggests the actual trigger for this loop is the mechanical vibration of injury, the erratic kinetic energy caused by joint shear and neuromuscular fatigue. The intervention developed to mitigate this is the ArC shielding system. It is a 3-pillar framework consisting of structural hardware, respiratory firmware, and metabolic fuel. ArC shielding is designed as a software patch for human biomechanics. It employs controlled movement patterns to insulate the autonomic nervous system from mechanical stress. By isolating the heart from erratic mechanical shear, cardiac intensity can be decoupled from joint impact, providing a controlled pathway for high-output conditioning. The hardware pillar focuses on the 360-degree clockwork pivot geometry, implemented here on an elliptical platform. The protocol utilizes a specific 10-to-2 arc of foot positions. This clock-based structure standardizes multiplanar lowing and manages rotational torque. The heel-driven vector reconfigures the kinetic chain. Driving force through the heel routes kinetic energy vertically upward behind the patellofemoral joint. This energy is absorbed by the hamstring glute anchor, allowing the posterior chain to function as a secondary ACL, stabilizing the joint. This specific method enforces dynamic valgus control, actively preventing the inward knee collapse and dangerous instability often seen during high-intensity metabolic work. Actively shifting the mechanical load to the posterior chain reduces the extreme shear forces that typically contribute to rapid joint degradation. There is a direct connection between joint shear and autonomic distress. The brain interprets erratic micromovements as physical threats, initiating a sudden sympathetic stress response. Because the ArC shielding protocol maintains documented structural alignment, it minimizes kinetic leakage. This prevents threat signals from reaching the nervous system. The cup of water test provides observational evidence. The subject generates 266 watts and 224 strides per minute while maintaining a perfectly stable torso. Despite the high-velocity output in the lower body, the lumbopelvic region remains centered, creating a stable, still point for the heart. This crucial core-to-base coordination ensures the heart is pumping within a vibration-free environment, removing the physical triggers associated with arrhythmia. The firmware pillar uses respiratory pacing to govern the autonomic response to high metabolic demand. The protocol begins with cardiac priming, slowly ramping the cardiovascular system to prevent sudden high-intensity shock. During peak effort, the subject maintains a strict 3-second inhale and 3-second exhale respiratory rhythm. This specific rhythm creates parasympathetic coherence. The controlled exhale stimulates the vagus nerve, which manually suppresses the body's sympathetic response. This data illustrates the physiological result. While heart rate reaches 176 BPM, the uniform sine wave of the breath cycle maintains autonomic control. The SDNN, a marker of heart rate variability, remains stable between 40 and 50 milliseconds, suggesting the heart successfully adapts to the workload. This respiratory firmware provides a mechanism for a vulnerable patient to reach high metabolic states while manually overriding the body's typical stress triggers. The final pillar is fuel, managed through stomach-first nutrition. By proactively identifying and removing dietary triggers for systemic inflammation, the subject reduces the baseline autonomic stress present before training. A chemically stable cellular environment allows the mechanical and respiratory pillars to function without the interference of chronic inflammatory signals. The development of this protocol is documented in a 9-year longitudinal dataset known as the ArC fault. This tracking shows a significant dip in autonomic resilience during 2023, followed by a sustained ascent to the 2026 elite state. Clinical verification relies on raw RR intervals, the microtiming between individual heartbeats. Zooming into the 2026 data reveals the precise intervals maintained during peak exertion. The tight clustering of these intervals suggests the heart is functioning as a stable engine, maintaining rhythm even under high metabolic demand. This density of objective data characterizes ArC shielding as a documented methodology of autonomic engineering. While this longitudinal dataset provides a detailed N=1 case study, these observations now require formal prospective evaluation. The mechanistic principles involved, vagal tone modulation and posterior chain load management, already correlate with existing clinical literature. The next logical step is transitioning this protocol into wearable monitored clinical environments.